Imagine a network that providers only leave when they retire. A network that goes far beyond adequacy and strives for something deeper. Compassion, commitment, connection. That's Health Network One.
When I hear the word Health Network One, I think of longevity. I have been with them since the very beginning, I think over 20 years. I think of the positive relationship that I do have with the company, and we've been together for a very long time.
Throughout the pandemic, we provided more than $1 million of PPE, along with a free-of-charge telehealth platform to our networks, ensuring they could continue to render care safely and effectively.
Health Network One went above and beyond to the point that it was jaw-dropping.
We weren't able to get anything. We were finding middlemen who were trying to get us Lysol, and all of a sudden every month we would get a package. Who's this package from? And it was from Health Network One. We needed gowns. The next thing we knew, we had gowns.
They provided also guidelines, OSHA guidelines to follow, and we were able to contact our representative if we had any issues regarding, vaccination rules or any of the new guidelines that were being set up. I work with no other network that actually provided PPE supplies to you. So that in itself tells you something about Health Network One.
We're proud that we cover more than 5 million lives, with networks exceeding 10,000 providers across therapy, dermatology, ophthalmology, podiatry, gastroenterology, and urology. And take pride knowing that we exceed the myriad performance requirements set forth by each state and our 24 health plan clients.
In a way, patients don't even know they're dealing with Health Network One. That goes in the background. But I think what is beneficial for patients is, one thing is affordability.
Knowing that you're part of a network that just keeps on growing, it allows you to know that you know where your next patients are coming from.
I know that my patients who've been using plans that are in the Health Network One tend to stay in the plans for many years. I don't see much churn.
Caregivers. 2 words, one important idea. It's how we see our providers, and ultimately, it's how your members see them too.
I'm a solo practitioner, so I really have very limited resources at my disposal. The most significant thing that Health Network One does for me is that there is a representative assigned to my practice.
No matter day or night, weekend, whenever, is a very comforting feeling, because when we do have challenges, Jessica Quintana, other members of the team really do try to help us achieve what needs to be achieved.
And that whenever I have a question or I have an issue, the response from my office manager is like, well, I'll just call and find out, as if it's something easy to do. And I know that that's not the case with most insurance companies.
In the hands of the right partner, delivering quality care to members is harmonious with delivering tangible value to health plans.
If anybody were to ask me from the provider point of view about joining Health Network One, I would say do it by all means. It is be the best decision practice-wise you'll ever make. It'll make practice on a day-to-day basis efficient, precise, and quite frankly, a pleasure.
That's us. That's Health Network One. More than a network. Compassionate, committed caregivers.